another thing that's ominous is any discussion of mRNA being used for things like cancer or bird flu, within either the, American body politic or more globally.
Yes, and actually, since you mention it, this is a great place to remind people of what you and I, the hard-won insight that we have over this is that a lot of ink has been spilled over the spike protein. And the spike protein is a problem in and of itself, to be sure, but the lion's share of the harm that seems to come from the mRNA shots is the platform itself, not the payload. Mm-hmm. And because of that, this should be dead on arrival. When we are told bird flu might be addressed with mRNA, the answer is, well, how the hell are you going to do that without causing myocarditis and a bunch of other pathologies that are the result of the immune system attacking your own tissues? You still don't have an answer to that question, because we know what an answer would look like. It would look like basically an addressing system that sent the mRNA to specific tissues that were effectively okay to be destroyed. But it has to be an addressing system that's good enough to prevent it from getting into your heart, or the whole thing is, the idea is DOA.
And we A, don't have an addressing system at all, and B, once one begins to be developed, there will be, of course, questions about its efficacy and safety.
100%, and you would need honest-to-goodness testing, and we have a system that isn't even capable of honest-to-goodness testing. One final thing, as long as we're here, people should be paying attention to the following thing. When you propose an mRNA platform shot to address a contagious pathogen, you're not going to escape the problem that's being described. There is no known mechanism to address these things, and so you should simply say no to any proposal, and anytime you hear it discussed, the answer is, well, have you solved that basic problem? Because until you have, this is a non-starter. There is a difference that we have to pay attention to when they're talking about it with respect to cancer treatments, which I also think we're a long way from anything useful. But the calculus is simply different if you are, facing a terminal trajectory, because you might well be willing to gamble on damage. In fact, we said early on that effectively some of the novel COVID drugs and the shots functioned in a chemotherapeutic fashion. That is to say, lots of damage to the body. And chemo, hopefully, when it works, kills the patient slower than it kills the tumor. That's the whole plan. So the point is, a dangerous mRNA shot in a patient who has a terminal tumor is a different calculus, and it's not inherently DOA, though it's not where I would go if I had got a dire diagnosis.
Yeah, and there was a question always about what the diagnosis actually means. And so we haven't spent a lot of time talking here on Dark Horse about how being tested all the time for lots of things means that there will be a lot more false positives with even just the stress and psychological harm that causes. But there will also be accurate positives for things that exist at a level that don't actually matter, that would resolve themselves on their own, or would grow so slowly that they would not kill you before you died of something else. And so the number of cancer diagnoses just writ large is much higher than it has been in the past for a number of reasons. Like, we actually have a lot more carcinogens and teratogens in our environment, and we are just swimming in them in large measure. But we also have so much more testing that we know much more. We have many more cases identified than we would ever have known before, and that is not inherently for the good. Not that some of that additional knowledge hasn't helped people sometimes. I'm sure it has. But on balance, it is not at all clear that the additional testing and the additional knowledge and the additional stress and psychological pain and often physical pain, because the traditional cancer therapies of chemo and radiation are terrible for the body, are on balance worth it. So I agree with you. I think I said something very much like that also to Jillian Michaels the other week, that when you have a terminal diagnosis, the math changes, the analysis changes. It would have to. But many people are being scared into believing that they have a diagnosis that may, even if they're not being told it's terminal, because I'm lucky. We have had almost no cancer in either of our families, and what has happened has been minor. And so, we have not dealt with these sorts of end-of-life terminal cancer diagnoses in the nitty-gritty very much. But my sense is that that the actual terminal diagnoses are usually fairly clear, and that in those cases you should try anything and everything. Now, I would also say that understanding cancer potentially as a metabolic disease and going to things like fasting is something that most doctors will never advise you to do, and that this is likely to be very useful in many cases. But that I would be very careful about hearing what you just said. The mRNA platform could be useful under extreme end-of-life conditions as a Hail Mary. Right? Hold on. And extrapolating out and saying, well, but I'm told that I've got, stage 3 cancer and it's probably going to go bad and I won't have the ability to make a decision later, and so I'm going to do that Hail Mary now. The thing is, you want to save a Hail Mary until the very last possible moment.
Yes,
that's the thing.
Let me just refine what I was actually saying. I wouldn't be interested in the mRNA platform at this point under almost any circumstance.
Yeah.
All I'm saying is that the calculus that says there's no way this could possibly be safe enough to use does not apply if you're already terminally ill. So there is a potential loophole there that I just think, in order to be complete about it, we have to be aware of. I do think, the history of what we have learned as we have become alert to cancers. I think we've had a very wrong model of cancers and how common they're supposed to be. I know that when I did my work on cancers in graduate school, I believed that cancer was one of 2 failure modes of the body that were effectively balanced. I now believe cancer is in a natural environment, probably much, much rarer than we currently think it is, that our environment is so toxic that we're creating a lot of cancer that wouldn't have been there. But we also know the story of cancer is, this is a classic case of welcome to complex systems.
Yeah.
Because you've got a lot of people who are dying of cancer. You come to think that cancer is an inherently terminal disease. You start looking for cancer. You find, oh my God, there's all of this breast cancer, and you're doing radical mastectomies and stuff. And it turns out, as you point out, oh, well, there's a range of how quickly these things grow. And some of them can be addressed, with a lumpectomy. Some of them can be addressed with, radiation that's hyper-local, where the radiation source is embedded in the tissue.
And some of them don't need to be addressed.
Right.
And it would have been better if the person who has the thing had never known.
Right.
And we will never get that down to perfection. Right.
But the point is, the body was dealing with a lot of cancer, and we didn't understand that. We thought that cancer was what happens when the body's mechanisms for dealing with stuff have given way. And the answer is no. If you look at breast cancer, if you look at prostate cancer, there's a lot of these cancers that are very slow growing, and depending upon how old you are and how rapidly growing it is, doing nothing may be the right thing to do. Mm-hmm. We also know, in the case of something like squamous cell carcinoma, one of the skin cancers, that it's really not very deadly at all. And, so anyway, there's a whole landscape of the body managing these malignancies. Mm-hmm. And we discover the ones that are worst because they're the ones that, somebody dies and this shows up on autopsy or however it works. But understanding that there are a lot of mechanisms that we're not aware of, because this is a hugely complex adaptive system that's been, preventing and managing cancer for, tens of millions, hundreds of millions of years. So our walking in and panicking over every cancer is a mistake. Yes. And also we know that as a result of our pharma and by pharma I mean patentable novel drugs, obsessed medical culture, that we're missing all kinds of therapies that have potential value that aren't potentially profitable, and therefore you've got a whole industry acting to ignore them. So anyway, there's a lot there.
Indeed. Did you feel like there were more things you wanted to say about global health and maybe Bobby? And, he got confirmed.
Yes, this is an amazing moment. We were in transit as this was happening, but Bobby has been confirmed, almost a straight party line vote, of course.